Hello listeners, welcome to Ensemble Daily News Analysis. This is AAISHA HASSAN and today's topic for discussion will be Agrarian Crisis, National Trade Facilitation Action Plan, UNAIDS. Agrarian Crisis. Agrarian crises are reflected in the increase of unmarketable reserves of agricultural commodities, the decline of price paid to the farmers for them, the destruction of a portion of agricultural produce for which there is no demand, a decline in the net profit of farmers, the worsening of agrarian overpopulation, the growth of hidden unemployment, and the decline of wages of agricultural workers. Current status of Indian agriculture. Indian agriculture is characterized by low scale and low productivity. About 85% of the operational land holdings in the country are below 5 acres and 67% farm households survive on an average land holding of 1 acre. More than 50% of the area under cultivation does not have access to irrigation. Agriculture income generated is not adequate to meet farmers' need. With a large population to feed, imports will not solve a problem if there is a severe drought and food shortage. Though agriculture now accounts for less than 15% of gross domestic product, it is still the main source of livelihood for nearly half a population. Reason behind the current agrarian crisis: landless farmers. Around 83% of the rural households are either entirely landless or own less than 1 hectare of land. Farmers' tiny plot of land can no longer sustain whole families, especially in the rain-fed agriculture, which accounts for 2/3 of India's total cultivable area. Shortage of money. Landless of marginal farmers lack the resources to either buy or lease more than land or invest in farm infrastructures like irrigation, power, farm machinery, etc. Different kinds of risks. Weather. The large majority of small farmers are dependent on the rains. A weak monsoon or even a delayed monsoon means a significant loss of output. Soil. The next risk is weak soil fertility, pest and plant diseases. Price. The better the price, the crop, the lower would be the price. Net income sometimes collapses if there is a very good crop of perishable. How MSP benefits the large traders instead of small farmers. For good grains like rice and wheat, government procurement at the minimum support price is supposed to protect the farmer. But MSP benefits the large traders who sell grain to the government. Small farmers typically do not have enough marketable surplus to justify the cost of transporting the crop to government corporation in the towns. In the case of other crops, agricultural produce market committees have the opposite effects. Farmers have to sell their produce through auction in regulated market controlled by cartels of licensed traders. These licensed traders give oligopolistic market power. Overcoming this barrier calls for a cooperative farming system. Shifting public investments towards modernization of surface irrigation works and for watershed development. Prioritizing incomplete irrigation projects after strict cost-benefit analysis and monitor implementation. Limiting government's role to laying down the broad principles and institutional frameworks. Entrust direct management of the land, water and common services facilities to autonomous organizations functioning within well-specified rules. Enforcing better preventive and punitive measures to contain gross violation of rules governing access to and use of resources. Conducting a critical review of the research system in public institutions to make it more effective. Changing policies relating to pricing of yield and input to avoid waste. But the challenges have to be confronted to overcome the institutional constraints and disincentives that are now the critical bottlenecks in realizing the potential for increasing production. Without it, the target of 4% sustained growth in agriculture will remain a dream. Advantage of cooperative farming systems. The advantages of aggregating small farmers into larger, voluntary and cooperatives include greater capacity to undertake lumpy investment in irrigation and farm machinery, more efficient farming practices, greater bargaining power, and better terms in the purchase of leasing of land, access to credit, purchase of inputs, and the sale of produce. National Trade Facilitation Action Plan. National Trade Facilitation Action Plan released on 20th July 2017 by Arun Jaitley in New Delhi. Aim of the National Action Plan. The action plan aims to transform cross-border clearance ecosystem through efficient, transparent, risk-based, coordinated, digital, seamless and technology-driven procedures which are supported by advanced seaports, airports and land border. NTFAP also awards specific responsibilities to all regulatory agencies like Customs, FSSAI, Drug Controller, Plant Quarantine, DGFT, etc. to be completed in a time-bound manner. This action gives a time-bound map not only for implementing TFA but also for India's initiatives for trade facilitation and ease of doing business which goes beyond TFA. Apart from activities under the ambit of TFA, the action plan also goes beyond to what has been defined as TFA plus category. Objectives. The objectives include improvement in ease of doing business by reduction in cargo release time and cost, transparent and predictable legal regime, move towards the paperless regulatory environment and improved investment climate through better infrastructure. Activities listed in the action plan. The action plan lists out specific activities that will be carried out by all regulatory agencies like Customs, Drug Controller, FSSAI, DGFT, Plant Quarantine, among others in time-bound manner. This coordination among all stakeholders is needed to achieve the objective of trade facilitation. The action plan covers many activities in the areas of infrastructure augmentation, particularly the road and rail infrastructure leading to ports and the infrastructure within ports, airports, ICDs, land custom stations that cut across all stakeholders for which various ministries like shipping, civil aviation, railways, road transport and highways, home affairs, finance, commerce, etc. have been assigned specific targets. Background. Earlier, a National Committee on Trade Facilitation headed by the Cabinet Secretary was constituted in accordance with Article 23 of the Trade Facilitation Agreement. The NCTF comprised of stakeholders from the government and the private sector including trade community. Later, the NCTF adopted 76-point National Trade Facilitation Action Plan, which is a reflection of the government's commitment to implement the Trade Facilitation Agreement. Trade Facilitation. The Trade Facilitation Agreement forms part of the Bali package agreed by members at the 9th Ministerial Conference in Bali. The agreement contains provisions for faster and more efficient custom procedures through effective cooperation between customs and other appropriate authorities on trade facilitation and customs compliance issues. It also contains provisions for technical assistance and capacity building in this area. And our last topic is UNAIDS. What is HIV/AIDS? Human immunodeficiency virus infection and acquired immune deficiency syndrome is a spectrum of condition caused by infection with the human immunodeficiency virus. Following initial infection, a person may not notice any symptoms or may experience a brief period of influenza-like illness. Typically, this is followed by a prolonged period with no symptoms. As the infection progresses, it interferes more with the immune system, increasing the risk of common infections like tuberculosis, as well as other opportunistic infections and tumors that rarely affect people who have working immune systems. These late symptoms of infection are referred to as acquired immunodeficiency syndrome. This stage is also often associated with weight loss. The report Ending AIDS. Progress towards the 1990 target is the annual scorecard for progress. The latest UNAIDS report reveals that more than half of the people living with HIV now have tipped in favor of patients. For the first time since the global onset of the HIV/AIDS epidemic, the scales have tipped in favor of patients. What is the idea behind the 90 target? Diagnose 90% of the people who are HIV positive. Get 90% of the diagnosed HIV positive people on antiretroviral treatment, and 90% of those antiretroviral should be virally suppressed. This is attained when an HIV patient's viral load reaches an undetectable level, curbing transmission. Global statistics. UNAIDS made the 2015 target of 15 million people on treatment and is on track to double the number to 30 million and meet the 2020 target. As of the last year, 19.5 million of the 36.7 million HIV positive patients had access to treatment. Deaths caused by AIDS have fallen from 1.9 million to 2005 to 1 million in 2016. Further, globally, AIDS-related deaths have almost halved since 2005. Statistics about India. The bad news is that the majority of the cases, nearly 95% cases in 2016, were concentrated in just 10 countries, India being one of them. India has 2.1 million people living with HIV, with 80,000 new infections annually as of 2016. In 2005, the annual incidence was 150,000 people. India is the country where most new HIV infections are occurring in the Asia-Pacific region. While India has made big progress with new infections dropping significantly, the emergence of HIV in some locations that were earlier considered not high-burden areas is a cause for concern. While the world seems to be on track to reach the global targets of 30 million people on treatment by 2020, access to medicines remains a major barrier and India plays a special role. The report states that although important progress has been made in improving access to medicines for people living with HIV, insufficient availability and poor affordability of essential medicines in low and middle income countries remain major barriers. Averting market failures. India's role in global fight against AIDS. Action focused on the intersection between intellectual property rights, innovation, and public health are vitally important for resolving market failures in medicine development and manufacture, unmet needs for research and development and pricing. This is especially true in light of concentration of the generic pharmaceutical industry in India and the global AIDS response continued reliance on the Indian industry, which supplied nearly 90% of the antiretroviral medicine in low and middle income countries in 2015. Thank you.